1. A nurse is caring for a patient with left-sided heart failure. Which of the following findings requires immediate intervention? A. Pink frothy sputum. B. Weight gain of 2 pounds in 2 days. C. Mild dyspnea on exertion. Answer. Pink frothy sputum requires immediate intervention. Rationale. Pink frothy sputum indicates pulmonary edema, a life-threatening complication of left-sided heart failure requiring urgent medical treatment. 2. A patient with right-sided heart failure reports increasing ankle swelling. What is the nurse's priority action? A. Document findings. B. Elevate the legs. C. Assess daily weight. Answer. Assess daily weight. Rationale. Daily weight is the most accurate non-invasive measure of fluid retention, which reflects worsening right-sided heart failure. 3. A nurse receives report on 4 patients. Which patient should be assessed first? A. A patient with heart failure who has new-onset confusion. B. A patient with heart failure requesting pain medication. C. A patient with stable vital signs waiting for discharge. Answer. The patient with new-onset confusion should be assessed first. Rationale. New confusion may signal decreased perfusion or hypoxia and represent a change in mental status that requires immediate evaluation. 4. A nurse delegates the task of obtaining daily weights in a heart failure unit. Which staff member is most appropriate for this task? A. Registered nurse. B. Licensed practical nurse. C. Unlicensed assistive personnel. Answer. Unlicensed assistive personnel. Rationale. Obtaining daily weights is a routine, non-complex task that falls within the scope of practice of a trained UAP. 5. The nurse is reviewing discharge instructions with a patient newly diagnosed with heart failure. Which instruction is most important to emphasize? A. Limit sodium intake to less than 2 grams daily. Answer. Limit sodium intake to less than 2 grams daily. Rationale. Sodium restriction is essential to reduce fluid retention and prevent exacerbations of heart failure. 6. A patient with heart failure is prescribed furosemide. Which assessment finding would require priority intervention? A. Blood pressure 110/70. B. Serum potassium 2.9 milliequivalent/L. C. Urine output 40 milliliters per hour. Answer. Serum potassium 2.9 milliequivalent/L. Rationale. Furosemide is a loop diuretic that causes potassium loss. Hypokalemia can lead to dangerous cardiac arrhythmias. 7. A patient with heart failure has a new prescription for carvedilol. What is the nurse's priority action before administering this medication? A. Assess blood glucose. B. Assess heart rate. C. Assess pain level. Answer. Assess heart rate. Rationale. Carvedilol is a beta blocker that can cause bradycardia. Heart rate should be checked prior to administration. 8. During education, a patient with heart failure asks why fluid intake must be restricted. What is the best explanation by the nurse? Answer. Limiting fluid helps reduce the workload on your heart and prevents fluid buildup in your lungs. Rationale. Fluid restriction helps manage symptoms by preventing volume overload, which can worsen heart failure. 9. The nurse is caring for a patient with heart failure who has dyspnea, crackles in both lungs, and orthopnea. What is the best position for this patient? A. Flat in bed. B. Supine. C. High Fowler's. Answer. High Fowler's. Rationale. High Fowler's position facilitates lung expansion and improves breathing in patients with fluid overload and pulmonary congestion. 10. Which of the following tasks can the nurse delegate to a UAP when caring for a patient with heart failure? A. Educating on fluid restriction. B. Monitoring vital signs. C. Adjusting oxygen therapy. Answer. Monitoring vital signs. Rationale. UAPs can monitor and report vital signs, but cannot educate or adjust oxygen therapy, which require nursing judgment. 11. A patient with heart failure is found to have a serum sodium level of 128 milliequivalent/L. What is the nurse's priority action? Answer. Restrict fluid intake as ordered and notify the provider. Rationale. Hyponatremia may indicate dilutional effects from fluid overload in heart failure and can become neurologically dangerous. 12. The nurse is teaching a heart failure patient about signs of worsening condition. Which symptoms should the patient report immediately? A. Mild fatigue. B. Productive cough. C. Weight gain of 3 pounds in 2 days. Answer: weight gain of 3 pounds in 2 days. Rationale: rapid weight gain is a sign of fluid retention and worsening heart failure, requiring prompt medical attention. 13. A patient on digoxin reports seeing yellow halos around lights. What should the nurse do first? Answer: hold the next dose and notify the healthcare provider. Rationale: yellow halos are a classic sign of digoxin toxicity, which can be life-threatening and requires immediate attention. 14. A nurse caring for a patient with decompensated heart failure notes cool, clammy skin, and a drop in blood pressure. What is the priority? Answer: initiate oxygen and notify the provider immediately. Rationale: these signs indicate poor perfusion and possible cardiogenic shock, which is a medical emergency. 15. A heart failure patient on spironolactone has lab results showing potassium of 5.8 milliequivalent/L. What is the nurse's first action? Answer: hold the spironolactone and notify the healthcare provider. Rationale: spironolactone is potassium sparing. Hyperkalemia increases the risk of cardiac complications and requires intervention. 16. A nurse is evaluating the effectiveness of diuretic therapy in a patient with heart failure. What is the most reliable indicator? Answer: decrease in daily weight. Rationale: weight loss reflects fluid removal and is a reliable indicator of effective diuretic therapy. 17. A heart failure patient is short of breath and anxious, with an SpO2 of 88% on room air. What should the nurse do first? Answer: administer supplemental oxygen as ordered. Rationale: low oxygen saturation and distress require immediate oxygen support to improve tissue perfusion and relieve symptoms. 18. A patient with heart failure is prescribed a low-sodium diet. Which food should the nurse teach the patient to avoid? A. Fresh fruits. B. Canned soup. C. Brown rice. Answer: canned soup. Rationale: canned soups are high in sodium and can contribute to fluid retention and worsening heart failure. 19. Which of the following goals is most appropriate for a patient with chronic heart failure? Answer: maintain oxygen saturation above 92% with minimal shortness of breath on exertion. Rationale: this goal reflects improved gas exchange and functional status, which are key in managing chronic heart failure. 20. A nurse is evaluating understanding after discharge education on heart failure. Which patient statement requires further teaching? A. I will check my weight daily. B. I can skip my diuretic if I feel fine. C. I'll reduce my salt intake. Answer: I can skip my diuretic if I feel fine. Rationale: diuretics should not be skipped without provider guidance, as symptoms may worsen due to fluid retention. 21. A nurse is caring for a patient with heart failure who is receiving 4-furosemide. The patient reports ringing in the ears. What is the nurse's priority action? Answer: stop the infusion and notify the healthcare provider. Rationale: tinnitus may indicate ototoxicity, a known side effect of 4-furosemide, especially if given rapidly. 22. A patient with heart failure is admitted with severe dyspnea and orthopnea. The nurse elevates the head of the bed. What is the next priority action? Answer: administer prescribed diuretic and monitor respiratory status. Rationale: elevating the bed eases breathing, but diuresis is essential to reduce pulmonary congestion and improve oxygenation. 23. A patient with chronic heart failure is being discharged. Which instruction is essential to reduce hospital readmission? Answer: call your provider if you gain more than 2 to 3 pounds in 24 hours. Rationale: sudden weight gain is an early sign of fluid retention and heart failure exacerbation. Early action prevents rehospitalization. 24. A nurse is preparing to administer digoxin to a patient with heart failure. The apical pulse is 52 BPM. What should the nurse do? Answer: hold the dose and notify the healthcare provider. Rationale: digoxin should be held if the apical pulse is below 60 BPM due to risk of bradycardia and toxicity. 25. A patient with heart failure asks why they need to avoid NSAIDs. What is the best response by the nurse? Answer: NSAIDs can cause fluid retention and make your heart failure worse. Rationale: NSAIDs can worsen heart failure by promoting sodium and fluid retention and decreasing renal perfusion. 26. A nurse is caring for a patient with worsening right-sided heart failure. Which finding requires immediate action? A. Ankle edema. B. Distended neck veins. C. Urine output of 15 milliliters per hour. Answer: urine output of 15 milliliters per hour. Rationale: decreased urine output indicates reduced kidney perfusion and may signal acute decompensation needing urgent care. 27. A patient with heart failure is being seen in the clinic. Which statement requires further teaching? A. I weigh myself every morning after using the bathroom. B. I take my diuretic before bed. Answer: I take my diuretic before bed. Rationale: diuretics taken at night can disrupt sleep due to nocturia. They should be taken in the morning unless otherwise directed. 28. A nurse is assigning patients on a cardiac unit. Which patient is best suited for an experienced LPN? A. New heart failure diagnosis requiring education. B. Stable heart failure patient needing furosemide. Answer: stable heart failure patient needing furosemide. Rationale: LPNs can administer medications and care for stable patients, but initial education must be performed by an RN. 29. A nurse is teaching a patient with heart failure about fluid restriction. Which patient behavior indicates understanding? Answer: the patient uses a measured container to track fluid intake. Rationale: accurate fluid tracking is key to managing heart failure and avoiding fluid overload. 30. A patient admitted with heart failure is receiving 4 fluids. What assessment finding would prompt the nurse to stop the infusion? Answer: development of crackles in the lungs. Rationale: crackles suggest pulmonary congestion, and continuing fluids can worsen heart failure. Infusion should be stopped. 31. A patient with heart failure is prescribed enalapril. What lab value should the nurse review before administering the dose? Answer: serum potassium. Rationale: ACE inhibitors like enalapril can cause hyperkalemia. Potassium levels must be checked to avoid life-threatening arrhythmias. 32. A patient with heart failure and reduced ejection fraction asks the nurse why beta blockers are used. What is the best response? Answer: beta blockers reduce your heart's workload and help it pump more efficiently over time. Rationale: beta blockers decrease sympathetic stimulation, lowering heart rate and improving long-term cardiac function. 33. A patient with heart failure develops sudden anxiety, restlessness, and frothy sputum. What is the nurse's immediate priority? Answer: elevate the head of bed and apply oxygen. Rationale: these are signs of acute pulmonary edema. Positioning and oxygenation are immediate life-saving interventions. 34. A heart failure patient with diabetes is prescribed metoprolol. What should the nurse monitor closely? Answer: signs of hypoglycemia without typical symptoms. Rationale: beta blockers can mask symptoms of hypoglycemia like tachycardia, requiring close blood glucose monitoring. 35. A nurse teaches a heart failure patient about low-sodium food choices. Which food should be avoided? A. Grilled chicken breast. B. Canned green beans. C. Fresh apple. Answer: canned green beans. Rationale: canned vegetables often contain high sodium levels unless labeled low sodium or rinsed thoroughly. 36. A patient with heart failure asks why they need to take medications if they feel fine. What is the nurse's best response? Answer: the medications help control your condition and prevent your symptoms from returning. Rationale: consistent use of heart failure medications is essential to prevent exacerbations and hospitalizations, even when asymptomatic. 37. A nurse is reviewing morning labs for a heart failure patient. Which value is most concerning? A. Sodium 138. B. BNP 1100 pg/ml. C. Potassium 4.1. Answer: BNP 1100 pg/ml. Rationale: BNP is a marker of heart failure severity. Levels over 1,000 suggest significant cardiac stress and fluid overload. 38. A home health nurse visits a heart failure patient and finds them using extra pillows to sleep. What should the nurse suspect? Answer: worsening pulmonary congestion. Rationale: needing extra pillows, orthopnea, is a classic sign of fluid backing up into the lungs, indicating heart failure progression. 39. A nurse receives handoff on a heart failure patient with a new prescription for hydrochlorothiazide. What should be monitored closely? Answer: serum electrolytes, especially potassium. Rationale: thiazide diuretics can cause hypokalemia, increasing the risk of dysrhythmias in heart failure patients. 40. A nurse is caring for a heart failure patient with reduced appetite and increasing fatigue. What should the nurse do first? Answer: assess for signs of worsening heart failure. Rationale: loss of appetite and fatigue may indicate fluid overload or poor perfusion. A full assessment is needed to intervene early. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!